Okay, so welcome to the NACDD ITACC peer-to-peer meeting on developing goals and objectives. My name is Angela Castillo-Epps, and I'll be helping facilitate this new kind of format for us today. We usually do webinars, and we've done several webinars in the past on goals and objectives, but we wanted to give folks an opportunity to really have this kind of peer-to-peer interaction to see if that would also help with getting your questions answered, getting input and ideas from other councils to help you in this process. So welcome to the meeting. We do have Rafa from NACDD also on the line to help us with logistics. If you have a question or need support, please put that information in the chat box and we'll be happy to help you. We also have Spanish to English and English to Spanish translation available for those who need to access that service. So please let me know if you have any trouble with that as well. You should be able to hear the interpreters in the room. Okay. All right, just letting in some last minute folks here. Okay, so just to go over quickly what our format is today, I'm going to go over a brief PowerPoint. Everyone already has this information ahead of time, and we'll of course post it to the site. It's just a pull out from our longer webinar that goes over just some real basics on developing good goals and the SMART method for developing objectives, just to provide a framework. And then we are going to hear from David Ingram from North Carolina and also Beth Stalvey from Texas. And they're going to just share some input, share some feedback on their council's process for developing the goals and objectives. And then we're going to break out into rooms because we have an extremely large group today. We already have we have over 60 people on the Zoom and more people registering as I speak. So we will break out into groups with facilitators. The facilitators are going to just help kind of navigate the discussion. We do want to make sure that everybody has a chance to participate in the group. So please allow for that and let your facilitator help you get through those questions and answers, and so we can have some real dialogue back and forth. Also, we do have if you have some technical assistance questions that do not get answered in your groups, the facilitators will bring those questions back, because we will come back to this meeting room all together to debrief and kind of go over those lingering questions that maybe didn't get answered. Also, just to let you know, since this is such a big group, if you do have very state or territory specific questions about your particular, draft goals or objectives, remember we can also Cheryl and I can also support you in that through rapid response and other methods as well, okay? So just to keep that in mind. Okay. So I'm going to share I'm going to attempt to share my screen. Okay. So that we can go through this information for you. And then again, you will have a copy of this, okay? So we're going to get started with our purpose. Again, we already said this. We're going to go over good goals. We're going to go over the SMART method for objectives. We're going to hear from council staff. Then you'll have your Q&A. And we do have an evaluation poll. Just like all of you, ITACC is also responsible for, evaluating our activities and making sure that they're helpful and useful to all of you. So in addition to it being very important to come back to the main room for any outlying questions, please also come back because we need to make sure we get as many folks as possible to answer our poll. Okay, so for goals, as you know, these are 5-year goals. You are all engaging in a data-driven strategic planning process. You're going to choose your areas of emphasis to undertake for the 5-year state plan through your council and your prioritization process. As you know, the information in your comprehensive review and analysis, or the CRA, is going to provide that information to base your goals upon. And as you know, that includes things like public input, stakeholder surveys, agency reports, your needs assessments, and whatever other data you have there in that very comprehensive CRA. And you're going to use that as your basis and your rationale for your goal development. So your goal is a measurable statement of purpose. It is designed for that long-term effect because these are 5-year goals. They do generally address change, of course. And you also want to make sure that you're defining your scope of work. And as you know, the goals, they kind of set the foundation for developing your objectives. At one point, you will get to your annual work plan, and you will be outlining your activities. And you'll look at it as your activities are the stepping stones to your objectives, and your objectives are the stepping stones to completing your goals. We want our goals to be specific. You want to identify your target population, and they do help to set your overall priorities. You know, the goals are viewed by your federal funder. It's like you're giving them a kind of a projection. Where is the council going over the next 5 years? You know, it helps them understand what are the pressing issues in your state or territory for people with IDD and their families. They should be able to see that when they look at your overall 5-year goals. So just some more information on the goal piece. You want complete sentences, of course. You are looking for an outcome. Jargon is really important. As you know, at a minimum, your goals and objectives are released for public input. And so since you're asking for public input, we want to make sure that we have goals that are really clear, easy to understand language, and jargon free, which is, it's hard for us because we're in the field and we're so used to words like capacity building, right? And other terms that can be not so easily understood by the general public. So, and that's an important piece when you're going through your goal development. And also, of course, being concise, being clear, also important, leaving out unnecessary details. So sometimes we see goal kind of statements, and they may include almost like paragraphs of information about the goal, how you came to, you know, realize that goal. But when you submit your goal, your 5-year goal, you want to make sure you're leaving out any unnecessary details so that the goal is as clear as possible. Okay. Again, easily understood, framed positively. And as I said, they are the stepping stones for your objectives. Now, we do have a lot of great tools on the website. One of them is we have a couple of checklists, and we'll show those in just a second. We have checklists for goals and for the objectives, which is a great way to review your draft goals and objectives as they're being developed. You can do that with staff. You can use those checklists with members as well, just to kind of go through and see if you're hitting these points. So here we have an example of a goal, an unclear goal, and a goal that's a little better, a little easier to understand. So under the unclear goal side, we have quality, affordable, accessible healthcare will be provided throughout the lifespan, okay? Which is maybe a little too broad for our broadly specific focus, right? As Cheryl likes to say. So our improved goal reads, people with developmental disabilities and their families will have increased access to healthcare services that meets their needs and preferences. So clear language identifies a population, and it's even, it even talks about the effect. What effect are we going to see increased access? So definitely a more improved version of that first goal. And these are the checklists. So this is the one for goals that I just talked about. Again, they're in the materials on the ITACC help.org website as well. Very easy to use. Can go through and chart your draft goals and objectives if you'd like. For the objectives, so objectives are more specific than the broader goal, right? So you have a broad 5-year goal. Your objective is now kind of coming down that funnel, so a little more specific. a measurable statement of the outcome. It will describe the results to be achieved. How will you achieve those results? This is how you set your targets for progress and accountability, and they're time stamped, which is important. So these objectives, they're like your basis for monitoring the implementation of your strategies. We go through the DDACC strategies and we see all these great ways that we have in the DDACC that we can implement our 5-year plan. And through those strategies, that's expressed in your objectives. How are you going to reach your goal? And that's what that objective piece does for you and outlines. Okay, so as we've seen this before, I'm sure, it just kind of helps guide you through the process. We know, and your federal funder knows that, different councils, different folks have different writing styles. You come from different cultures and regions of the state and territories. And so your language is going to change and to reflect your individual council needs. But as you go through this is just a good way to kind of check yourself on some of these areas. So we look at things again, being specific, again, your target population, how much change is to be expected, the measurable piece. Achievable is also very important. Can it be accomplished given current resources and constraints? I think this is really important too for, the councils where the members want to do it all, right? They see that money, they're ready to go. They want to fix every problem in the state and territory in one swoop, right? And I think, that's a hard thing to kind of navigate as staff, right? Is the prioritization process, because you do have limited resources and you have limits to your funding, and it's understandable. All of the areas of emphasis listed in the DDACC are very important. They're very important facets to community life. So you do want to look at things like, is it achievable? Is it realistic? Because this will determine your outcomes, right? You want to have a successful plan. So these are also important pieces of the objective to think about. And then again, the time phase. When will the objective be met? Okay. Cheryl, if you have anything to add as we go through, please feel free to jump in. Okay, so here we are at the, again, with the objective. So one that's maybe not following the guidelines and one that's a little more improved. So under our non-SMART objective, we have create an environment which assures the need for quality, affordable healthcare addressed by healthcare providers and incorporated into state policy through advocacy, training, and dissemination. So the language on that maybe is not so clear or understandable by your general public, and kind of doesn't identify kind of who we're working with here. So for the SMART side, the SMART objective example, we have it time stamped at by 2024. The council will increase knowledge and awareness among 200 people with developmental disabilities and their families about the availability of healthcare and how to access healthcare related services and supports. So again, a nice broad goal, 5-year goal, or, again, you timestamp it for what's good for you. And you're identifying your population and you're talking about, what the plan is. You have your output there. So that's a little bit better of an example. Just also wanted to mention, and so sorry, I know I feel like a broken record with this, but you also have 3 elements of your self-advocacy mandate in the DDACC. And we just want to also remind you that, all 3 elements of that self-advocacy mandate is to be worked on every single year of the 5-year state plan. So this is just a couple examples of objectives around the self-advocacy mandate, which are good. Michigan is calling. So one example, by the end of each fiscal year, at least 5 self-advocate leaders will increase leadership skills of 20 people with DD who want to become leaders. Very clear, very in line with the mandate. Another example, by 2024, the council will provide support and training to 75 parents who have DD to increase their participation in schools and community activities with their children. You're identifying a population, you're time stamping it, you have your measurements in there, and we know kind of exactly what the council is going for. And again, here's your checklist for the SMART objectives. Again, I do recommend using this to go through your draft goals and objectives with staff and/or members. You can be used in committees. Okay. And then I always like to put this up, but especially in light of COVID, we have been advising councils to kind of put that emerging issues or emerging trends piece in. We can help with that if you need some individual council support on how to word that. But we do like the idea of having an emerging issues or trends objective that if something like COVID were to come up, or maybe even the after effects of COVID, right? Because we're not sure, what that's all going to entail. But if you leave that placeholder, then it helps you when something does emerge to be able to address it in your state plan process. Okay, so real quick, we're just going to go over some resource reminders. I have been listing resources for months and months in field notes under the state plan development section. But as you know, related to 5-year goals, we do have the PowerPoint and recording from the last webinar that we did on goals and objectives. That also includes more information for you on the advocacy, self-advocacy mandate that we just talked about. It'll have more information for you on targeted disparity, and it will also have more information for you on planned collaboration. So those materials are there for you as well. And also our objectives brief, which is just really clear-cut overall brief that goes over goal and objective development. Okay. And if that's not enough, there's more. So in your state plan development resource, there is also Appendix D. And in Appendix D, you're going to have, again, more information on developing measurable goals, your objectives, your expected outcomes, and that also has examples in there for you. So that's pages 54 to 57 of your state plan development resource. Again, all linked to itachelp.org for you. And you have us. So as I said in the beginning, of course, Cheryl and I are available for one-on-one support, rapid response. I've been reviewing some draft goals and objectives, meeting with councils on state plan development, and we are happy to do that. Okay. And again, please note, you will have access to that. I actually sent it to all of you before. If you did not receive it, we will send it out again in a follow-up email, and it'll be on the website. So what I'd love to do, just in the interest of time, and we're doing well, is to turn it over to David Ingram from North Carolina. David is the systems change manager and just has a wealth of knowledge to share with us about his process through his council, maybe some tips and information to support all of us. Then we will also hear from Executive Director of the Texas Council, Beth Stalvey, before we go into our breakout rooms. So David.
Thank you. And I'm fortunate enough to have our Executive Director on the call as well, Tally Wells, to chime in for any added information or anything he feels is important. Tally and I both are new to the 5-year state plan development process. I have a couple years ahead of Tally to get familiar with at least the prior 5-year state plan. What I think Beth might touch on in a moment is something that North Carolina experienced in the last 5-year state plan development. Is sort of, it was the 5-year state plan we had prior to this one was not well understood by the council itself. It seemed very esoteric or academic in nature. And so it had a large number of narrowly focused but steeped in rich data goals and objectives. And so it made it very difficult to be nimble. So in the time of COVID, it would have been quite difficult to sort of merge things and make things work without significant updates, which we all can do each year, but it's not without its difficulties. And waiting 3 to 6 months when something needs to happen yesterday can prove really frustrating, especially when a council is needing to, feeling the need to understand fully what they're doing. So something that had happened that we're looking to continue is having our goals and objectives in sort of an easier to understand format. So we had 3 goals this last 5-year state plan, centered around financial asset development, community living, and advocacy development. And those were tied to surveys that we had with our USAID partnership, going through the data, the discovery survey information. And then each goal had 3 objectives within them. And then we additionally set up for our council meetings committees that represented and reported on each goal. So they would, in the committees, vote on financial asset development committee would vote on financial asset development related initiatives. Community living would vote on those related initiatives. And then they would come back from committees and talk with the full council, have discussions and questions and answers, and then have their full vote on sort of the business day as we have it set up for our quarterly council meetings. Something still, though, that hasn't made sense to everyone is our evaluation methods. We do have report outs every council meeting for how the initiatives are doing. That's part of the evaluation. It's happening, but it's not fully understood that's what's happening. There are conversations about how's it going? What's the initiative accomplishing? And those report outs are largely within the committee, which is appropriate, but the full council doesn't always get those updates. And then there's no full report aside from what's in DD Suite for the council staff to review and discuss and try to make its way into the committee meetings, but we haven't fully tied together everything. And I think it was in the 2019 ITACC conference that Cheryl in Tennessee presented on some sort of methodologies for that. So I'd recommend that we all look at that again. But ways to have the council understand that there's an evaluation process here that ties into the logic model for how they're funding initiatives and what the end goals are that are tied to the goals and the objectives. So this year, what we've tried to do is make sure that we have the data to support what we're focusing on. Well, really to make sure we're focusing on what the data presents, right? So we have talked with our state agency partners, and we had our survey that we pulled from the Center of Excellence in IDD in North Carolina. We disseminated it again. We had roughly 800 responses, if I'm not mistaken. Looked at that information. We did listening sessions throughout the state virtually. And the feedback was overwhelmingly, let's keep a lot of the same thing, but we also need to focus on youth in education and transition into adulthood. And in North Carolina, there's a significant wait list for one of our Medicaid waiver, 1915 BC waiver services or waivers. And almost every listening session and survey we had talked about those 2 needs. It was slightly different between individuals living with IDD and families, and then especially different from that and stakeholders at large. But we're looking at what we did to sort of streamline the process in reviewing all that information is we set up an ad hoc committee with council members from each sort of current goal that we had, and asked them to give their time, and they thankfully did, members from the executive committee, and met roughly once a month to go over the survey results, to plan what we're going to talk about at our next council meeting around the feedback we're getting. We walked through different goals that we had and started talking about what updates would the council like to have to those goals based on the data that we spent a couple hours presenting the day before. And we had breakout rooms based on a mixture of committees, so we could have the perspective of everyone involved and had them talk through the current goals and recommended edits from our ad hoc committee. And so now where we're at is we contracted after all of that for an individual with an MPH and MSW to come and work with us on sort of streamlining what we have to make it make sense and to sort of have an outside source of conversation around what feedback we received and how we want to merge those into our current goals and logic models. So where we're at right now is we have an updated set of goals and objectives and logic model for us to meet back with the ad hoc committee to talk about how relevant and appropriate it is, whether or not they're actually SMART goals. So we'll be looking at this PowerPoint. That meeting's on the 22nd. And then that's in advance of our council meeting. We'll be looking at approving either the goals and objectives or approving the executive committee to sort of work with the ad hoc committee on approving those. So I'm not sure how helpful any of that is to everyone, but that's been our general process and how we're trying to represent everything. Tally, if there's anything to add, especially being so new. He joined us right before COVID hit. So I think he saw us in person for maybe 3 weeks.
Yeah, thanks, David. That was excellent. I don't have a lot to add, but I will say just two sort of tangential things. One is, you know, I've learned so much from the other executive directors, even though I'm super new. And I also had a fair amount of experiences of working as an ally with the Georgia Council. So that was great to sort of at least know what the Georgia Council was doing when I moved to North Carolina. And one of those things led me to really think, as we do our 5-year planning, we really need to rethink what we're doing at the North Carolina Council around public policy, given some of the critical issues that were happening in public policy in North Carolina. And so one of the ways I felt that was important to do that was to not be person coming from Georgia, just coming to tell North Carolina a new way of doing things, but instead to put together an ad hoc committee that was in addition to our 5-year planning of council members to then meet with other councils in other states to hear from advocates in North Carolina of what the need was for the council and where sort of we were doing things and where we might want to move things around a little. And then to talk to Cheryl and Aaron from our national folks to give us some perspectives on how we do that. And that really enabled our council to sort of hear what are some different perspectives so they could think that through. And I think it's really informed our 5-year process. So that's been I think, super helpful. And then the other thing that I've really struggled with as a new executive director is the fact that we've got to start making budget decisions because we have such a long grant application process that we're really thinking pretty carefully right now about FY22. And some of the spending decisions we have to make, even though we haven't finalized our 5-year planning. And so I don't know what to say about that other than it's super helpful to get ahead of the 5-year planning because we're making funding decisions that are going to sort of precede our plan. And that's been interesting just to sort of get my head around.
Yeah, and that's an excellent point, Tally. I mean, that's what we were talking about when we were talking about, you know, those goals and objectives being realistic and achievable. I mean, your budget, of course, is a big part of that, right? You have your resources, you know, staffing and your funding, and you really have to balance that with what, you know, the 5-year state plan, you know, comes together and looks like, right? So excellent point. And, you know, I think your information was very helpful, David. It's good to hear how you've kind of breaking this down in the committee work and how the information is being shared on a regular basis. It's a very open exchange of information in your process in North Carolina. And I think it's really served you guys well. So that was very helpful. I appreciate that, you and Tally.
And Nia has a great question based on what I said that I don't know the answer to.
Okay, yes, we will definitely get to anything that's in the chat box. And then remember, that's what the Q&A session is for too. We're going to break into groups so that people can really have that exchange and get some great information and ask the questions. But yes, we will get to all of the questions. Our goal is to get to all of the questions before we leave here today. Please know this, we do have this running about 1 hour and 15 minutes-ish because we have a lot to get through and the group is large. We're up to about 69 people now and someone just registered. You know, we do need to have some time so that you really can have that peer-to-peer exchange. So hang in there with us and we'll get to our breakout room soon. So Beth, if you have anything like to share, we'd love to hear from you.
Sure, thank you. Hello, everyone. It's good to see you. I will just share a couple of points so that we can get to our discussion groups, Angela. Like North Carolina, Texas has really been trying to make some improvements over our last plan. Our last plan goals and objectives were really focused a little bit more on the how. For example, making sure that we were introducing a greater number of best practices, for example, and now we're really trying to focus on the outcome from the individual side and what a person would experience as a result of our work. So that's one shift that we have made. I'll just mention 3 things in terms of tips. One is that our previous state plan, we had 27 goals and objectives. Now, I'm very fortunate to be a larger allotment state, and I'm very grateful for that, but 27 goals and objectives, it was physical. I think I got through goal 1 in terms of action planning and writing all of the data collection and evaluation measures, and I almost could not get to the rest of the goals without taking a 3-day break. And so I just don't think that was sustainable. So we, with the help of our fantastic technical support team, was able to consolidate our goals and objectives down to 9. And so that is a much more manageable number and has been much easier in terms of reporting. So please keep the depth of reporting and planning in mind when you're developing all of these. The other that I'll mention, similar to North Carolina, our council always, I think, has a difficult time with a lot of the rules and regulations and bureaucracy that goes with our work. And so we really tried to keep our council similarly focused on outcomes, really anytime they got kind of sidetracked on process, to try to direct them back to, wait, what is it that you're trying to accomplish with this? And then from that, our staff could hear what they were saying and try to draft that into a goal statement to give back to them. Is this what you said? Is this what you would like to support as your goal? We did do, similar to North Carolina, we did some council member work groups. It was the first time we've done that with our council. I think that was very helpful. We did have to look at our state laws around public board meetings and make sure that we were not convening a public board, but we set up, we were able to get a good 7 members could convene at once without it constituting any kind of committee meeting or sub-board meeting. And so we just scheduled 4 or 5 different work group meetings and let people individually talk to each other and kind of work through what we were doing. And I think that was very helpful. It made our next council meeting, when we discussed the broader goals and objectives and approval, it made that, I think, go a lot smoother. So, so that worked well for us. The other unique feature, maybe not unique, but for Texas, we have a very difficult time picking or committing to 1 to 3 topics. And so I know I've heard other councils say that they can have a whole goal, for example, on financial literacy. My council obviously has issues with picking one issue. They like to cover them all. So while I appreciate their efforts, again, from a planning perspective, it means that our goals and objectives have to be very broad, and then we try to get to specific topics more at the objective level is what we have chosen to do at our state. So in our next state plan, we hope that we will only have 2 goals. And that we will have a total of 9, again, goals and objectives that will cover all of the areas such as civil rights and education and employment and health and well-being and things like that. So that's how we've structured ours. We're getting more into the details of the topic at the objective level. So, so I'll stop there. Those are just a few things from Texas.
Thanks so much, Beth. It's extremely helpful. And it is, you know, it really is a journey, right? The process of kind of, especially when you inherit a state plan, as the new directors are very well aware and new staffers are aware, you come on board and here's, you know, a year's worth of work and 5 years worth of, you know, planning and implementation occurred before you even got there, right? So it is a journey, you know. You do kind of have to find your way and develop your relationships with your council members and your staff, and it's helpful to hear kind of how your process emerged, Beth, to be one that was more productive for you and manageable, and that's a really key part. So thank you for sharing that. Okay, and if you didn't see it, Cheryl had an excellent answer to Nia's question. So if you didn't see it, one of the practices councils have found useful when having to post the RFPs for projects, activities and initiatives that are included in the new plan is that you can include a statement that funding for the project is dependent upon the federal approval of this upcoming 2022 to 2026 state plan. So that's a great tip for folks that are looking at that budget piece that Tally brought up. Okay, great. All right, so we can stay on our time frame. If it's okay, we are going to move to our groups. Again, we have Cheryl helping us out. We have, I believe, Erin Prangley, Rachel London, David, Beth. So Rafa has helped us with the rooms. And Rafa, whenever you're ready, or if there's anything I can do to help you, let me know.
No problem at all. Everyone will be getting the invitation right now.
Okay, great. And don't forget, we're all coming back to the main room. Okay, and if you're still on the line, if you need Spanish translation, I'm so sorry, I forgot to say that, you're going to stay right where you are. You won't get a request to move to a breakout room because we cannot offer the Spanish translation in breakout rooms. We can offer them in the main room. So you should stay here. And if you do get, yeah.
Deanna here, if it's for me, I can join any group. I don't need translation.
Okay, no problem, Luz. If you want, it's still a group. It's still going to be a group of peers in the room, the main room. It's just that that's where we're going to make sure our services are. Okay. And Cheryl, I believe you're in the main room too, from what Rafa had said. I know he's working on it now.
Cheryl should be in the main group.
Okay.
Yeah, she's right there.
Okay. And then I can move around, Rafa?
You should be able to, yes.
Okay.
Well, it's good to see everybody today. I want to open the floor. So why don't we focus our first bit of time and on goal, on the topic of developing goals. If you guys want to talk about a goal that you have developed and want input on that, or if you want to just ask, any question about goal development, what works best, how you put it together, the process of getting it in front of a council for approval. Let's just see what's on your mind. Everybody's on mute. Don't be shy. Come on.
There we go.
Come on, Brenda. Bring it on, Brenda.
Bring it on. So I'm working with a team in New Jersey, a really dedicated, innovative team of folks. And I'm that outside person whose job it is to kind of pull it all together. And here we are. So our state is going to be one of those going from like 9 goals and 40 objectives down to half of that, which still sounds big compared to what some of my colleagues are saying. But for goal number 2, we're looking at something like New Jersey citizens with intellectual and developmental disabilities and their families and allies will have will have increased ability to improve the design and delivery of the services intended to support them. So this is sort of our collaboration systems change piece of things. And we're really trying to, the data is showing that our service system is really fragmented. Families lack a sense of service coordination, a sense of interagency collaboration. And we really want to get families involved in helping to reshape those systems. And that kind of cuts across a number of our areas of emphasis. So under that, we have some cascading activities that focus on those different systems. Is that goal okay? Is it too broad? Is it, I mean, I checked the boxes, but I just need some quality feedback.
Yeah. So, you know, in and of itself, it looks like that you have all of you have the SMART elements there, right? So we know who we're going to affect. We know what we want to have happened. Now, the trick is, you do have your result, you have your outcome. So what you're working towards is improving the design and delivery of the services that are, and I just love words. They're great. Intended to
Yes,
support them.
That was intentional.
I figured it was.
Tongue in cheek,
So,
but intentional.
yeah. So it comes down to the increased ability. And so right now, I mean, you guys, in thinking about your goal, this is, you said this was your kind of collaboration, coordination, systems change focus.
Right.
So I think it does convey that, because you're talking about increased ability that could be measured in the sense of the opportunities the council and partners are creating to address design and delivery of services. It could be giving them training and education about service systems and how they work, and advocacy around that. So I do think this is a good goal. I think it is indicating to the public that you want to increase citizens' ability to impact service delivery systems. So that's good. I had a thought and then I left it. So
let me ask you something, because you said two things that I wanted to check in on. I've got improve, and you used the word impact.
Oh, sorry, that's just me.
Okay.
That's my word.
All right. So, and then the other question is, I used increased ability because I really want to look at skills and access, but you used the word increased opportunities.
Oh,
is that better? Or is that?
No, because increased ability could be opportunities.
Okay. Okay.
So I think, you know, what you're trying to do is build capacity of people, individuals, to really impact these systems, but they're impacting it for an improvement.
Got it. Okay.
So ultimately, you know, when I look at this goal, I will channel my inner federal program officer, I would expect to open your program report at the end of the year and see that your work is now, you know, leading towards some kind of improvement of a service system that provides support to people. And, you know, it could be a number of things. One year it could be educating people about it. The next year it could be, you know, whatever. I mean, it could be anything, but yeah, I think you do want the indicator. What I love about what you've created is that you've put the ultimate, the end goal, the end result in the goal to improve the design and you said and delivery.
Yes. Both.
So the design and delivery of the services. So that's everything the feds are going to want to see you. What did that result in 5 years? Okay. What did you improve?
Got it.
So it's good. Very good.
Good.
Sherry, hi, this is Luz. I have a question.
Hi again. It's related to the target disparity.
Okay.
If we want to develop a goal and our act or object related to target disparity, how would be the thing that we have to make sure that we not get broad, we go very specific to that, to achieve that object or goal? What are your recommendation to that?
Yeah, I would encourage you guys to look at your goals first and see if a targeted disparity objective can be supported with one of your goals. By keeping it as an objective, it will that means it's very it kind of keeps it all contained. And so the activities underneath that objective would all speak to targeted disparity project. And if it's a goal, then you have to have more than one objective for a goal. So it makes it a little bit more difficult. And it doesn't matter the size of the council, because the targeted disparity objective is for the council to identify a group within the larger intellectual and developmental disability population. And so that's it. When you guys start looking at the discrete group within the DD population, then that is where you get your very specific focus. And that's based on your comprehensive review and analysis, what you found there, coupled with if you guys have done a survey of citizens, or people living in the district, and you're trying to figure out, well, what population seems to be, not being served at an equal rate, or what population is experiencing more difficulty on an area than other people in the DD community. So that's really where you're trying to identify that group, and then identify the issue. So I've noticed with the councils, Angela and I work with lots of councils across, last year. And what I've noticed is council members are chickening out. They don't want to identify a group within the larger group, because that is exclusionary, right? It's like some people want it to be all people with all people with DD. I read one from a council, and they said they wanted to reduce housing disparities for everyone. And I'm like, well, now wait a minute, because for all people with DD. And I said, well, wait a minute, are you saying in your state everybody else without DD has affordable housing? Well, no, we have a huge housing issue. And I'm like, okay, so we got to think about this. So, you do need to think just a little bit deeper into, what it is that you're trying to, reduce the disparity. And then keeping it small allows you guys to measure whether or not you actually reduced the disparity. If you do something that is state or territory wide, think about, no one's going to tell you you can't, all right? But think about what money or resources, staff time, whatever, do you need to evaluate that particular project to prove that you reduce the disparity. And that sometimes helps council members understand that you can start off small. If you have success early in the 5-year plan, you can always replicate, do it in a different area of the state or territory, expand it. It doesn't mean that you're going to just cut everybody else out, but you have to have a focus. Does that help, Luz?
Yes. Also the time, because the disparity they implies some kind of system change, right? Why are the recommendation that when we addressing this, we can working in that objective?
Yeah, but think about it. Maybe I would think about it just a bit differently and almost treat the targeted disparity item as a demonstration project and get your results there. And then you guys can take up. So you prove something, right? You prove through your work that something worked to reduce a disparity. You guys can always add a systems change initiative as the result of that work that does not have to be identified as a targeted disparity. It's building upon the work. And so I think you have those rich opportunities to do that. So, you know, it's not all things considered. You can prove, you know, whatever you're trying to reduce, think about it in terms of demonstrating that that strategy works to decrease a disparity, and then think about how you're going to build upon that particular work.
Yeah, just to add to that, Cheryl's right. I mean, you always can, as your plan progresses, you know, you may have different strategies that then come about, right? So you do demonstrate, and maybe what evolves from that demonstration is the need for a specific targeted policy or systems change. You know, those things kind of ebb and flow as that work progresses. And I always like to say too, you know, the disparities have been around for a really long time. So they do take time and effort and energy to impact. So the idea of targeting, you know, that's exactly what Cheryl's saying. You know, the idea is to target and then have that success and then learn from it too, right? You also learn things from demonstration, and then, you know, how can you expand that and build upon that work? It's you know, it's a lot of work, and it's kind of very deep work, and it's very relationship oriented, engagement oriented. So it does take time to do it and do it well.
So do you guys have questions about objectives?
Even
Hi,
if
Cheryl.
you,
This is Jermaine.
Hey, Jermaine.
Hi, good morning. Sorry, I'm not turning on my camera because I'm still at home and
It's
not really
okay.
ready for work yet. It's 8 in the morning. But I know when Angela was doing her presentation, she some of the objectives had numbers, right? Like 200 individuals or 20 individuals are gonna be trained to do this or that. Is there a I mean, is it mandatory, or I guess to have like numbers? Like, the only reason I ask is because Guam and I believe some of the other territories probably face this problem, is that our population is so small that we're hesitant to put numbers only because we may not meet that expectation. So
No, great question. You know, the quick answer is no, there's no rule. The rule is that you have to have a measure. So simply stated, a measure can be increase, improve, it can be a hard number, but some councils really like numbers. That's might not be you, right? So because sometimes it freaks council members out to see a bunch of numbers, because then they're like, oh my God, all we're doing is getting numbers. So I would encourage you guys to think about the measure. If you want to increase people's knowledge of how to get services, You say that. And then remember, in the annual work plan, you guys do have to put numbers, right? So you have to put some measures there of how many you think you're going to get to. Now, most councils, to be honest with you, they will lowball. They go low on numbers. So if you say 10, you're going to reach 10 people, the feds will not blink. They do not get worked up about that. This is all about your geographics, your landscape, your territory. It's they don't get worked up about that. So don't be afraid to to put a number in. I know you guys have seen that PPR, and if you don't hit the number, it makes you say, I didn't do it, even if you did most of it.
Yeah.
So that's the real, we would love to see them step away from that particular item. That's why councils really are paying a lot of attention and going, if you think you're going to hit 20, they're putting 10.
Okay. And
I don't know what else to say.
yeah, no, it makes sense only because I think when you do put a number, it kind of gives you something to go after, right? It gives you like a like an end goal, right? And then
Yeah.
if you're not meeting it, or if you're tracking to not meet it, it kind of pushes you to kind of meet it. And then if you look like you're gonna go over it, then you're like, okay, I've met my, it kind of gives you more reassurance that you've been able to meet that particular
Yeah.
measure.
Now that's a
Okay.
good point. And I do think, and of course I will give you the other side of the story. The reason the feds put those want you to report against whatever the numbers you're projecting is so that you are forced to pay attention to the strategies that you used and then did not meet what you expected, because that would tell you, oh, well, maybe we need to do something different, or maybe that strategy for that particular activity didn't go so well. Maybe we should try something else. And so it's forcing the council to pay attention to adjusting whatever activities you guys are working on.
All right. Thank you.
Mhm. So I think Brenda had a good question in the chat box on the collaboration objective, the requirement for collaboration. One question we've gotten a lot recently is, does collaboration have to be just with the USAID and the protection and advocacy, disability rights? Yes, it cannot include other people. So if you guys are, I've seen several councils objectives written as the USAID, the PNA, and other collaborators. That's not a collab, it won't meet the test for the collaboration item. So make sure that you've got something that you're working on that is just the DD network. Now, here's the thing, write it that way. If your activities then include bringing other collaborators to the table, then that would be an activity. So, but keep your objective pure so that you can pass the test. I mean, it is about passing the test for the element, if you will. And you don't need a formal agreement. You don't need a formal letter of support. If you do that, that's a local council decision, but the feds do not. I don't think there's a place to send it, one thing, and it's not required. So anything extra, remember, if it's not in the state plan template, Office of Management and Budget has not approved the federal government to collect that data from you, and they cannot ask you for it.
I have a question in that area, and Sherry, again, is about if it's required that at least one activity had to become the trip party in this, the DD network had to be at least in the three at the same time in the same activity?
Yes.
Or so that is a one requirement. And also we can have split that also, right?
You can do things just with the PNA, and you can do things just with the USAID. But to meet the requirement for the DD network collaboration, it must be all three. So you have to have everybody's in the pool.
Cheryl, question. We have a number of activities in New Jersey that we do collaboratively with our DD network partners. Is it smart to include them in many things that we do, or just one, even though we work with them with lots of things?
Identify one. Okay. And I say this because, you know, as part of what you guys probably, you know, nobody needs to know this, but I'm going to tell you anyway. So you'll have more useless information for your perusal. But when they're reviewing your PPRs, and they do review your PPRs, they review your state plans every year because it's part of their monitoring system. They are looking for those discrete things because they're using a checkoff tool. And the checkoff tool says, was there a DD network collaboration item? And so clearly identify one of your activities as that. If you include your PNA and USAID on everything you want, if you do targeted disparity, diversity outreach stuff on everything you do, that's great. Identify one, because you're going to be held to a little bit higher standard because it's a required element for the plan. So I don't overreach. Just get yourself committed to the one item. Let your plan speak for itself, because you're only identifying that stuff for their purposes, not yours. So part of it is what you need to do for them and to get approved, and the other part is for your council and your public.
Beautiful. Thank you.
And to answer your question, Brenda, there is not a template for building the report. The feds are recommending that you guys kind of do it, you know, break it apart by sections in a Word document. But it's still up in the air on what a system will look like. And I can't tell you, they're not even talking about it.
I saw the character count in one of the most recent things. So that's,
yeah,
that. Okay.
That will hold. So we got that approved. So that's all good. And it's just, you know, they're just saying use Word will probably, a Word document would be something that would be pretty compatible for any, to be able to cut and paste and transfer. Yeah, they have to have this ready so you guys can submit a state plan. So it'll be interesting. Burning questions. What do you guys need? Most people ask me, how many goals do you have to have? Can you just have one goal? No, the feds are looking for at least two. So try to do two goals. Some councils are very simple with how they present goals. They'll do it very easy with like an individual and family advocacy goal and a systems change goal. Some councils just take care, and when you look at your objectives that you've written, your objectives need to be this is how people get those really big, like Beth Stalvey. I know I worked with her council to get her objectives way down. Every single objective was actually an activity. So think about your objectives in terms of, you know, is it supporting the activities? Is my objective statement something that if I put all of my activities underneath it, that all of my activities would lead me towards whatever this objective is saying? So if you have an objective around, and because I have it, if I'm going to steal some of Brenda's stuff because I have it, it's sitting in front of me. So I'm cheating, Brenda.
That's fine.
But
Pick it
it,
apart.
like, if you've got an activity, and she's got an activity draft that talks about collaborating with educators and stakeholders to support projects using best practices to reduce suspension and expulsion. Okay, that's a great objective. Now, activities underneath that could be training educators. It could be training community mental health people, definitely training family members. It could include systems change. It could be a number of things, but it's not, some of the things we see as an objective is written as the council will provide suspension and expulsion training to family members. Okay, but that's not an objective. That's an activity. So just when you're rereading what you've created or you're getting ready to create, just remember your objectives really are that measure. What are you working towards? And then how do those objectives then help you reach your 5-year goal? And they should be easy to connect. One more example, and I think then we have to go back to the big room, but I was working with a council that had a goal about youth transitioning to community. And then their objectives underneath that was emergency preparedness and first responder training. Okay, got it. And so then I start asking questions about where are the activities about youth transitioning to life after school? Well, it's emergency preparedness. I'm like, okay, well, help me understand. You know, so we had to really, if you have to really work hard to make the connection, you probably want to revisit and say, maybe that wasn't what we really wanted to do in that goal. So just saying. Okay, I think Rafa has sent us a note saying we are going back to the big room. I know that there are some polling questions that I know we would love to have your input on about format and helpfulness. So if you can hang out for, you know, just a couple of more minutes, I think this system will take us automatically back to the big room. It'll tell us that we're being excused. And there's no refreshments. That's the bad thing. So you don't get a bottle of water and you don't get a dazzling granola bar or an apple or a cookie. So we'll all do it virtually. I have a bottle of water on my desk. Any parting words? Oh, we are in the big room. We don't go anywhere. I'm sorry.
You are the big room facilitator, Cheryl Matney. You are already in.
We're in the big room. Here I'm saying we're going to go somewhere. No, we're not. Y'all are all coming back to us. No, you're not.
Welcome back. Welcome back. People are filtering back in. We'll give them a minute. Welcome back. Okay, welcome back. Yep, it takes just a minute for everybody to load back in. All right, wonderful. It looks like we did probably lose a few of our folks. So I really appreciate, again, all of you for hanging in here and going through this whole new format and new process of the peer-to-peer. I got to jump around in a couple of rooms and the conversations were amazing. So very excited about that. Since just in the interest of time, we do want to reach out to our facilitators real quick. And if any of the facilitators have burning TA questions related to goals and objectives, we want to be able to hit a couple of those and take a few minutes to address those. And then we do have, again, a quick evaluation poll to put out that we are, of course, going to need people to answer. Yes, the animals are making an appearance. I love how you see people's cats walk by and everything else. So, but yeah, I mean, if the facilitators, I don't know.
I do.
Sure, Beth, go ahead.
So we had a great discussion in our breakout room. I will mention an unsolicited tip. I guess our group acknowledged the fact that the importance of emerging issues, and we had a couple of folks mention that they had that was an oversight that wasn't already included, and that they needed to go back and include emerging issues in some way in their goals and objectives. So I just wanted to mention that on behalf of our group. I had two questions. One, we had some discussion about whether or not our goals and objectives should have specific numbers in them, or could they be directional? And I know that your presentation clearly articulated examples of putting numbers in. So we all listened, but then we still want to ask the question.
Yeah, and I think it came up in Cheryl's room as well. You know, we are looking for some type of measurement, right? So generally that can be an increase or a decrease. As Cheryl said, some councils do love numbers. I can think of a few. So they may have actual percentages. They may have actual counts, such as 20 people trained, things of that nature. But, you know, that comes in your reporting too. You know, you do want to have some type of measurement, but it could be as broad as increase or decrease. Just be sure that you're also, you know, you're coming from a baseline though, right? Though you may not need to put the specifics in the objective, you should have ways to measure that if you're going to say increase, that you are showing in your reporting, you know, where that increase came from.
Thank you. And then our last question related to that, if we were to submit an intentionally broad and directional goal and objective that ACL decided they wanted some more detail on that and decided to not approve our goals and objectives, then is it only if they request a change in the goal that it goes for another public comment period, or is it any change to the goals and objectives?
Oh boy, aren't you the deep thinking group today? So here's what's happened in the past. Let's go there. If in the review process, which I think they're trying to get a peer review process, you would still get conditional approval to move forward, but you will be given, if they identify something that they have concerns about, okay? They'll give you conditional approval. They will identify what they have given, what the condition is. And if it's a goal or an objective, they're going to ask you to change it within a specific time period. It will either be 30, 60, 90 days, and it depends on what it is and how big it is. So if that's the case, and the goal change is significant, it alters the original intent of what you submitted, then yes, it would have to go back out for public comment. And you would be given the longest clock possible. If it's still too short, you guys would have to communicate with your program specialist and tell them what a reasonable time frame would be for you to address that issue. So it's kind of a negotiation. There's not really it's not a one and done answer, but I just think that you don't get freaked out about, this really short time frame. I do believe they're going to use a very similar process that they did in the last state plan cycle, and lots of councils had to address items in the state plan. But you're not being shut down. You're getting conditional approval and time to correct or fix something. So yes, I think it is. And the question is it true whether it's a goal or an objective? The your federal project officers and staff have indicated the minimum for public review and comment is goals and objectives. So, if you're changing objectives, I wouldn't say, no, let me take all that back. The goals need the public comment. Objectives, in this case, for conditional approval, it depends. Again, it depends. Is the objective out of line with what the DD Act requires and wants councils to work towards? So if you have an objective in your state plan that you're going to do something that's not consistent, like support non-community living options, that kind of stuff, that's not going to be consistent with what your funding source and the purpose of the DD Act indicates. So they're going to say something about that. So, but generally, you guys, changing an objective, adding an objective, deleting an objective in a state plan year is a non-substantive change. That goal is the big deal. So you want your goals to be really reflective of what your work is and what you're working towards.
Thanks so much, Drew. Yeah, go ahead.
So this is Erin from group 3, which was a great group. They had 3 burning questions, but I think they answered all of them really well in the question. The first had to do with, of course, the problem of overlapping projects that overlap different goals and objectives. And they got some great feedback from Eric and Elizabeth. But I wanted to point out that Elizabeth from Missouri said that, she found the way to do the reporting without duplicating is to decide where the project fits best. And then at the end of that goal or objective, just put in one sentence in the narrative that says that the activity would also apply to this additional goal, but to avoid duplication, we're reporting it here, which I thought was a great way to handle that. The other burning question was about where do you report outreach to community? The big problem of communities that are difficult to reach. And there was a great discussion there about reporting projects, again, using the narrative section. And then the final thing was, I think, to the point about public comments. And the question, I think, is how do you incorporate your feedback from public comments into your reporting? For example, you have 900 plus comments on the front end, but then when you put things out for public comment on your goals and objectives, which are rather high level, you don't get very many people comment back. And there was one good suggestion from Jolene, which was that that their council, the Tennessee Council, released with a brief video talking about their goals and objectives and kind of ways that they got to that, which kind of helped people, shape, people who didn't want to read a pretty dense document, shape their comments. And then Eric also said that, people mostly won't read this full document, so don't worry too much about reporting. You don't have to, but you can report about your activities somewhere else. Just focus on the goals and objectives, but also give people time to talk about activities, since that's what they really want to do. not during the public comment section part, but in other activities. And as long as you keep all that data, that it can be useful in the future.
And I just wanted to add to that, video explanations are such a great way to address accessibility too. I mean, you could do videos in other languages, you can have your closed captioning. So, of course you have, different learning styles out there. So I love the idea of kind of increasing that accessibility to the information from the council through that method. So anybody else? I know it's getting a little late and I want to put your poll up. Any other facilitators have some questions for us? This has been amazing. So David, did you have something?
Yeah, well, I just wanted to highlight some of the support the group provided each other in group 4. A lot of other questions have already been mentioned prior to me talking now. But there was a question about what do you do if a council member is feeling passionate about a certain topic and is getting caught up and sort of the process of going through creating the plan is getting caught up into this individual who has a passion that you want to harness. And the sort of response that I hope I'm getting correctly is there can be a conversation with them about, is this something that we want to address in year 1 or year 2? Do we want to wait and see how it's going for this? And we can always make updates and let's consider focusing. We're not going to dismiss it entirely, but let's consider focusing on this as we go and tracking it so we can decide where it fits best within this 5-year plan. And I thought that was a neat way to handle it. And then separately for the comprehensive review and analysis, one of the councils in group 4 had been updating the CRA through something called issue briefs, so that the council could digest that information on specific topics. And I liked the idea. I think it wasn't exactly happening this way, but it sounded like it was, of sort of updating that as you go, as you evaluate your initiatives and how they're going, so that you have that work done all throughout the 5 years. Go ahead.
Okay, great. Thank you for that. And someone Ann put in the chat offering an activities parking lot, for to kind of help, get through that process, because we know that the council members definitely have their own background, right, and their own agenda, and they come to the table with a lot of information, and it's a lot of coordination that needs to happen, right? It's you're speaking with that one voice, though people come from many different perspectives, the council wants to be that one voice, especially united under the goals and objectives of the plan. So thank you for sharing that. Anything else? Any other facilitators, or did we get everybody?
The only other thing is I've also seen on the question, David, you posed is in working with some councils, I mean, I see the passion and just really trying to bring a point home, and really trying to remind council members, you don't get enough money to address everything. So it becomes the real delicate balance of prioritizing what you can affect. It does not mean that issue is not incredibly important. And again, using the strategy of, is there another way to do that? Bring attention to it through position papers, issue briefs. I think that's really a good idea when you may not have the data to support a full-blown goal or a bunch of objectives, and then and I just remember facilitating a council, and the council members' issue was immigration, but there was very little data to say that that was a top priority for people with IDD. It did not mean that the council was not going to harness her power and her energy on this in a larger, different type of setting. So there is a way to do it. I think you just have to massage it.
Yeah, that's a great point, and comes back to just, really a lot of, that was a perfect, all the way around to the beginning, because we talked about that in the beginning too. And that's that whole piece of, the council being able to put together something that's comprehensive and supports their state or territory, but there's so many other facets that go into developing that plan with such a diverse group of people. So it is definitely a balance. So thank you so much for that. I think we're going to launch our poll. I mean, of course, if you the chat is still going. People are helping each other through the chat. So please continue to do so. That's perfectly fine. This is a, it's very short. It's just 5 easy questions just to give us a chance to get a handle on how this format worked for all of you. Very exciting that so many people registered, right? I mean, it's wonderful. I mean, couldn't have had I think we had in the room when we started 67 people. So very exciting to have such a great large group and people interested in the format. So just a couple quick questions. Again, 15 in all. Again, we are here. We are here through rapid response. We are here through, you know, meeting with your state plan development committee. You know, if there's something that we can do to continue to support your state plan development process, we are here for that. Please remember to continue going back to the 5-year state plan page. It is filled with information. Cheryl is developing things and posting stuff almost every day. So there is really a lot of great information and resources on that page for your process. If you get into that page and you can't find something, or if you pull it up and you're not sure what it is, contact us. We're happy to help you with it so that, you know, you really know what tools you have and that you know how to use them. So you know, continue to use that that page for your planning. Okay, great. Thanks so much for answering. We actually almost have everybody answered so far. Any other last minute comments or Cheryl or the group while we're finishing up the poll? Oh, I want to say something real quick. I'm sorry. So field notes should have went out in our new MailChimp format. MailChimp does offer greater accessibility than the format that we were using before. You know, please let me know how that went. If you received it, if you didn't receive it, again, it is a new process for us to be sending it through MailChimp. It's been linked to the website. It's been linked to NACDD's social media. And there's just great stuff in there. A great highlight from Colorado on employment. It has the save the date for our performance measures meeting that'll come up in March. So definitely make sure you check out your field notes. And Cheryl, of course, always has really important dates and information in Compliance Corner. So I just wanted to put a plug in that since you should have it. Sorry, Cheryl, if you had anything.
Oh, no.
I just didn't want to forget.
No, I'm good.
Okay.
Yeah, and we can post on the ITACC listserv a link over to field notes as well. I know that my field notes went in my junk email. It's definitely not junk. So you might want to check that if you're used to seeing it come to your inbox.
Yeah, junk or spam. Mine actually came to spam, and then you can adjust that within your email settings to have it not be considered spam or junk. But mine did come to spam, and so I'll go through and check that process. And if you need help with any of that, let us know. But thank you for saying that, Cheryl. I actually meant to say that it could for this first time show up in junk or spam. So perfect. Thank you. All right. Okay, great. And it's great to know that some people are getting it. That's wonderful. And of course, you can always go right to the website. I always link it on the homepage all the way through until the next edition is available. So, okay, great. It looks like we're good. I might just have a couple more people for the poll. And if you're done your poll and you're good for today, thank you so much for joining us. A special thank you to our facilitators who jumped right in. Always grateful for your support. Thanks, everybody.
Thank you. Have a good night.